Welcome to Concept in Medicine. In this tutorial, we are going to be looking at how to suspect iron deficiency anemia and thalassemia using the full blood count. Let's begin by looking at the first method. So the first method is what we call the Menses Index. What then is the Menses Index? The Menses Index is a ratio of the mean corpuscular volume and the red blood cell count. The mean corpuscular volume, the normal limit, ranges from 80 to 96 femtoliter. And for the red blood cell count, the normal limit will vary based on the gender. If you are female, you have a particular normal limit. If you are male, a particular normal limit. How then do we use the understanding of the Menses Index to create a high index of suspicion for thalassemia and iron deficiency anemia? So if you have a Menses Index greater than or equal to 13, then there is a high index of suspicion for iron deficiency anemia. And if the Menses Index is less than 13, then the high index of suspicion goes for the thalassemia. Let's look at two examples to depict that. Let's say you have a full blood count report and the red blood cell count is 4.0 times 10 to the power 12 per liter. And the MCV, which is the mean corpuscular volume, is 72 femtoliter. How do you tend to create a suspicion? How do you tend to suspect iron deficiency anemia and thalassemia? So the first one, we use the Menses Index, as we have described earlier on, which is a ratio of the mean corpuscular volume over the red blood cell count. So with that, we have the mean corpuscular volume to be 72 divided by the red blood cell count. Note, in this scenario, we are not going to use the times 10 to the power 12. We are going to use the figure that is without the times 10 to the power 12. So we'll have 72 divided by 4. This, only this number, that is what we are supposed to use. 72 divided by 4 to give us 18. And 18 is greater than the 13 threshold that we mentioned. Therefore, it is suspicious of iron deficiency anemia. The second example, red blood cell count, same, 4 times 10 to the power 12 per liter. MCV, mean corpuscular volume, 50 femtoliter. Using the Menses Index, that will give us 50 over 4, which is equal to 12.5. And 12.5 is less than 13. Hence, we can suspect thalassemia. Now, let's move ahead and look at the second method. And the second method is what we call the red cell distribution with RDW. And you should know that the RDW is a measure of the range of variation of the red blood cell volume and size as part of the standard full blood count or complete blood count. Now, you should know that in that scenario, the red cell distribution will be equal to the standard deviation of the mean corpuscular volume over the mean corpuscular volume times 100. And in a full blood count report, the RDW parameters are given. So in that case, the normal RDW, which may vary from lab to lab, is equal to 11.5 to 15.4%. If the RDW is elevated, then we can suspect an iron deficiency anemia. And if the RDW is normal, then we can suspect thalassemia. So using the two methods, we should be able to have a high index of suspicion for either iron deficiency anemia or thalassemia. I believe we've learned something interesting. Kindly make sure to subscribe to my channel, like, share, and also recommend to your pals. And don't forget to comment the next concept you would like to see in my video. My name is Dr. Del, and this is Concept in Medicine. Bye-bye.